Health Ministry sets new course for private GP fee review. Imagine a world where a visit to your family doctor, a cornerstone of healthcare, hasn't changed in price for over 3 decades. This is the reality faced by millions in Malaysia, where consultation fees for private GPs have remained stagnant since 1992. But here's where it gets controversial. The Health Ministry has recently been tasked with revisiting this issue, following a directive from the Dewan Rakyat, Malaysia's lower house of parliament. In a statement on July 31st, Health Minister Datuk Seri Dr. Dzulkefly Ahmad revealed that the cabinet had been presented with a review of private GP consultation fees. However, the proposal was not accepted as is. Instead, the ministry was instructed to refine its approach and engage in ongoing discussions with stakeholders and interested parties. This move to revisit consultation fees, which are governed by the Private Healthcare Facilities and Services Act 1998, Act 586, follows a question posed by Tan Kar Hing, PH Gopeng, in Parliament. Tan asked whether the Health Ministry would consider a more balanced approach beyond the Price Control Act, and whether it could review the consultation fees for private GPs, which have remained unchanged for nearly 30 years. This is the part most people miss. Dr. Dzulkefly had previously announced on March 13th that revised consultation fees for GPs would be disclosed before May 1st. However, on June 9th, he mentioned that the review had been escalated to a task force chaired by Deputy Prime Minister Datuk Seri Ahmad Zahid Hamidi. The Medical Practitioners Coalition Association of Malaysia, MPCAM, has proposed increasing fees to between RM50 and RM80, highlighting that current fees range from 10 RM to 35 RM, a figure that has not budged since 1992. This situation raises thought-provoking questions about the value of healthcare services in Malaysia and the impact of stagnant fees on the medical profession. What do you think? Should the consultation fees for private GPs be increased? And if so, by how much? Share your thoughts in the comments below. The Health Ministry's decision to refine its proposal and engage with stakeholders is a step in the right direction. But it's crucial to ensure that any changes are fair to both patients and healthcare providers. The challenge lies in finding a balance that supports the medical profession without imposing an undue burden on patients. As we await further developments, one thing is clear. The conversation about private GP fees is just getting started. Stay tuned for updates as we explore this complex issue together. This is not just a matter of economics. It's about access to healthcare and the future of medical practice in Malaysia. And this is the part most people miss. The implications of this review extend far beyond just the consultation fees. It's about the quality of healthcare, the sustainability of medical practice, and the well-being of millions of Malaysians. Let's dive deeper into this conversation and explore the potential impacts of this review on the healthcare landscape in Malaysia. What's your take on this? Agree or disagree? Share your thoughts in the comments below. GP fee hike stalls as Dzulkefly defends Act 723, drug price display battle in Malaysia. Are you tired of skyrocketing drug prices and opaque GP fees? The Malaysian government is trying to bring transparency to healthcare, but the latest developments are stirring up quite the controversy. In a surprising move, Malaysia's cabinet has asked the Ministry of Health, MOH, to refine its proposal to review private general practitioners' GP consultation fees, despite these fees remaining stagnant for over 30 years. This comes as the MOH had already presented a paper on the matter, but now it's back to the drawing board. The proposed increase in GP consultation fees from the current 10 rands roaming $10 to 35 rands to 80 rams has been a topic of heated debate. While the MOH has not disclosed the exact figures it's proposing, the change could significantly impact the healthcare landscape. But here's where it gets controversial. The MOH is also defending its stance on enforcing the Price Control and Anti-Profiteering Act, 2011, Act 723, for drug price display. This move has sparked a debate among healthcare professionals and consumers alike. Is this the right approach to ensuring price transparency? Or does it infringe upon the professionalism of medical practitioners? Medicines are defined as pharmaceutical products, and the Act 723 provides a legitimate framework for price transparency, said Health Minister Dzulkefly Ahmad. He explained that the price display policy is not a control mechanism, but a means to share information about selling prices. This explanation raises thought-provoking questions. Does the display of medicine prices truly serve the public interest, or does it simply complicate the doctor-patient relationship? And what about the long-standing issue of fixed GP fees? Shouldn't they be reviewed to reflect the current economic climate? Dzulkefly further emphasized that the MOH has conducted extensive stakeholder engagement sessions, including meetings with industry representatives, professional associations, and private healthcare providers. Public consultations were also held via the government's Unified Public Consultation, UPC portal. However, not everyone is on board. Private medical practitioners have expressed concerns about the enforcement aspect and the burden of consultation fees that haven't been revised in decades. This is the part most people miss. The MOH's initial stance on taking jurisdiction of the drug price display mandate under the Private Healthcare Facilities and Services Act, 1998, Act 586, has been reversed. What does this change mean for the future of healthcare in Malaysia? As the debate continues, 2 judicial review applications have been filed at the High Court to quash the Price Control and Anti-Profiteering Price Marking for Drug Order 2025. The outcome of these cases could significantly impact the healthcare landscape in Malaysia. What do you think? Is the MOH's approach to drug price display and GP fees the right way forward? Share your thoughts in the comments below.